From confinement on a cruise ship to confinement on the Wirral, 32 British and Europeans evacuated from the Diamond Princess off the coast of Japan flew into the UK this morning. They will now spend 14 days in quarantine at Arrow Park Hospital. All have tested negative for the new coronavirus disease, COVID-19. But left behind in Japan, in hospital, are David and Sally Abel, a couple from Northamptonshire who have both tested positive and who both now have pneumonia. The number of cases in England is still only 9, but the NHS has now started piloting home testing for the virus and preparation for any potential outbreak.
So any individual that we think may have come into contact with coronavirus, after assessment, we will come to their home to do the necessary nose and throat swabs. So that means NHS staff will come to you. What we do ask is that you don't go to see your general practitioner and you don't go to an A&E department. That's the best way we have of reducing the spread of the virus.
It is hard to believe, but it's only 52 days since the outbreak in Wuhan and Hubei province was reported to the World Health Organization. China has now officially confirmed more than 76,000 cases and more than 2,300 deaths. This is the inside of one of the new hospitals built in Wuhan. The beds filled with the critically ill and those recovering. 80% of patients develop mild forms of the disease, but it is the 20% who prove more challenging to treat.
Most of the critically ill patients suffer from breathing difficulties and low oxygen concentrations, along with other organ injuries. Plus, their conditions change rapidly and we have to adjust their treatment plans quickly to stop any deterioration.
Containment is still the WHO's catchword, preventing significant spread to other countries. But today there was a warning from its Director General that the window of opportunity was narrowing.
Although the total number of cases outside China remains relatively small, we're concerned about the number of cases with no clear epidemiological link, such as travel history to China or contact with a confirmed case. We're especially concerned about the increase in cases in the Islamic Republic of Iran.
In the midst of their election in Iran, health officials have now confirmed 28 cases of COVID-19 and 5 deaths. None of the patients are believed to have travelled to China.
We are seeing cases that have travelled from Iran and are confirmed that they've come from Iran. And this means that there's potentially a lot of cases within Iran that are perhaps not being reported yet. And then the major worry is that from there, where could it spread from Iran? There's strong connections to countries like Afghanistan, Pakistan, Iraq that don't have such strong health systems, and being able to contain the disease then becomes challenging.
South Korea is also causing concern with 433 cases officially confirmed, an 8-fold jump in infections in just 4 days, most of them linked to a church and a hospital in the city of Daegu. 3 people have died and 17 are said to be critical. While a dozen towns in northern Italy effectively went into lockdown on Saturday after the deaths of 2 people infected with the new virus and a growing cluster of cases linked to a local hospital, but with no direct links to China.
Well, just before we came on air, I spoke to Dr Margaret Harris via the internet from Geneva. She's on the World Health Organization's coronavirus team.
So we are now seeing spread in countries outside China. As I'm sure you know, before the vast majority of infections were in China, and China, in fact, gave us a couple of weeks, according to the experts, the modeling experts. But now we are seeing that there are more clusters in Korea and in Iran and now in Italy. And this does, and also we're seeing cases that don't have a clear epilink. That means they're not associated with travel to China or to people who are infected. So that is raising the alarm and means we, as our Director General said, the window of opportunity is closing.
Does that mean then, in layman's terms, that we could be on the brink of a global pandemic here?
It means we certainly all have to be ready for the arrival of coronavirus in our communities, which means health systems, individuals, everybody has to be on the alert.
And some countries have stopped flights to and from Iran, for example. Is that an overreaction or is that a sensible precaution in your view?
We tend to say no travel restrictions, mostly because when you stop flights, it means the help that countries need can't get in as well. So we send a lot of supplies to different countries. We've sent supplies to laboratories around the world and also to health workers around the world, protective supplies. So when we stop flights, when we stop that transport, the help people need is also stopped.
I mean, this may be a sort of how long is a piece of string question, but how long do you believe that countries around the world might have to stop this becoming a pandemic?
So this is a new virus. This is the problem. We are watching this and learning every day. Now, one of the really good things, if there's a good thing to say about this, is the sharing of information by all the scientists, all the health workers, has meant that we've learned very, very quickly, but it's too early to say what we are really looking at in the end.
And you talk of learning there. The WHO has been on a learning exercise really in Wuhan now. What has emerged from that meeting today?
So I hate to be always saying too early to say, but our experts met with counterparts and also with the officials in the city today, and that will yield a lot of very good information. And as soon as we've got some very clear signals, we will certainly be letting the rest of the world know.
And just your hunch, I know you don't really deal in hunches, but do you believe this is going to become a pandemic, or do you think we can avoid it?
This is a very serious and it's a very infectious virus. The one good thing is it seems to infect a lot of people. It doesn't kill everybody. Unfortunately, though, if you're older, if you've got other health illness issues, like you've got lung problems or you've got heart problems, you're more at risk. So do what you can to mitigate that. Stop smoking. Do everything you can to protect your health, knowing that if you are in those groups, you are particularly at risk.
Dr. Margaret Harris, thank you so much. Well, I also spoke this afternoon to Zhou Jiaxin in Wuhan. He's a correspondent for the China Global Television Network, which is owned by the national broadcaster. And I began by asking him what the WHO had learned on their visit to the city.
Earlier, WHO executive leader said the main priority for the team on the ground is first and foremost to learn as well as to understand the nature of one of the largest public health responses in history in China, adding that there are lessons to be learned from the responses of the crises at all levels. And the head of WHO said at its daily briefing on Friday that the measures China and other countries have taken have given the rest of the world a fighting chance of containing the spread of the virus, calling on all countries to continue their containment measures while preparing for community transmission if it occurs.
Mm-hmm. There has been quite a lot of criticism of China's initial response and quite a lot of anger as well at the silencing of the doctor in Wuhan who's now sadly passed away. Is that anger still there?
I think for the death of that doctors, the National Health Commission has already extended condolences to that, and I've already seen many internet users online to share the passion or sympathy over the past.
Another medical worker in Wuhan has died. How confident are you that health workers have the protective gear that they need, that they're not being overworked and therefore making themselves more susceptible to infection?
Protective gears, as you mentioned, is really an urgent need still. And over the past weeks, we have seen this kind of national trend, and also the central government has called on all manufacturers, if possible, to ramp up their preparation. Because I arrived actually late in January, and back then when I had those interviews with nurses and doctors in hospitals, they tried to save their protective gears by, saving not to drink water, not to have the food, and then, keep themselves in that ward for at least 4 hours so that they can save one piece of suit. But now I think the situation has been improved.
Chinese citizens around the world have faced discrimination and racism after this coronavirus outbreak. How concerned are you not just about the epidemic itself, but an epidemic of ignorance that has followed it?
I think many Chinese overseas try to show the world that we're not the virus. But sometimes, it has been politicized, as, the foreign minister said that there might be the political virus among some other countries. It's not about human-to-human transmission, but it's about human-to-human compassion during this period.
Do you believe that Westerners are panicking about the virus, or given the number of deaths in China alone, more than 2,300 now, is that panic in some way justified?
Yes, I think there is panic. I would be, honest that I did not have the panic when I received the task to come to the epicenter of the outbreak, because I think there are two kinds of panic. So I think, as I mentioned, that the government is trying to expanding the knowledge to the citizens. So I think that's the rational panic, because, of course, they're afraid of the death, because in the beginning the number was really horrifying. And there are another type of panic is the irrational panic. As we talked about the political virus, I think this is another panic which is not necessary.
Zhou Jiaxin, thank you very much for joining us.
Thank you, Kathy.